Okay, so let's go. We're going to go over all the vessels that are listed here, the ones you need to know, and I'll also tell you ones that we won't have to have you know. So if you look here, and this is on the heart, so it says coronary arteries are the first thing, right? Coronary arteries, you can see they're going to be on the heart itself. There'll be see the little red vessels right there. So those would be your coronary arteries. And it's going to be as simple as that. If you see a blood vessel on the heart, we don't think you have cardiac veins, but veins would be blue, the arteries would be red. Next thing you have is the aorta. Now the aorta, what it does is it comes out of the top of the heart and arches over, and you can kind of see it right here. It's arching over, then going down. And I think the best way to see this, I got to be careful because those are really sharp ribs. Oh, you don't have this dissected, so I'm going to have to do just a very quick. Some of what you did is really good, and then these have not been dissected out. But what I'm doing here is opening up the pleural membrane next to each one of the intercostal arteries. So now you can see it, right? So I got to get that to. I don't want to hurt myself, but let's do this. That's better. I know, I heard it too. So great. Here's your aorta coming down, thoracic aorta. Here are the intercostal arteries on both sides. You can see them very well. And then we'll talk about, as we go through the diaphragm, this is traveling through the diaphragm right here, going in now to the abdominal aorta down below. So we go to the next thing, pulmonary trunk, pulmonary arteries. I'm not going to ask you to know those. And the reason why is because they come directly off of the heart, and then the pulmonary trunk goes upward, but they go into the lungs. So the arteries are going to be here, and then on this side, right down here. And actually there's some here, but we won't test you on them. Those are pretty good. That's some of the better ones I've seen in a while. And then right brachiocephalic artery. So the brachiocephalic artery is on the right side. If you'll notice here, the aorta comes up and then arches. This main vessel coming up right here, that's a brachiocephalic trunk. What you're going to see, a little bit different in a human than it is in a cat, but what you're going to see on the cat is you're going to see coming off the brachiocephalic trunk. Remember, brachial means arm, cephalic means head. So this is the left common carotid artery coming upward. Left common carotid. It's not completely dissected off of here, but there it is as well. And then the right common carotid artery is right here. And just so you know, that's the vagus nerve setting right with it. The little white thing, you see the white thing right there? That's vagus nerve with it. So that's right common carotid artery. And then the right subclavian artery is this dude right here. So subclavian. So these are going into the head, the cephalic part, and then this is going to the arm, the brachial portion, and that's why we call it brachiocephalic. So then the next thing you have left subclavian, right subclavian arteries. So the way we do this, we say here, this is going to be the subclavian. You can see it on the left-hand side going up, and it's going to swing around just above the rib here, and it's going to go then out into the upper extremity. You can see the red right there. See the red? Okay. So here we're going to call this the subclavian. We call it subclavian. That means underneath the clavicle, but it's labeled the subclavian until we get through or past the first rib. Once we get past the first rib, we're now in the armpit region. We'll call this the axillary, because armpit, axillary, the same thing. And then once we get past the inferior border of the teres major, then the axillary becomes actually the brachial. But I'm not going to ask that on the test. But so what I would say simply is if we tagged it right here, you would say subclavian. If we tag the one on the right-hand side, we would call this subclavian. Once we get past the ribs into the armpit region, we're going to call it axillary. And when we get down into the arm, then we'll call it brachial. Okay? And do they do the other one? So the other one has a really good radial and ulnar. But the radial is going to go off on the radial side, and the ulnar is going to stay more on this side. And I'm not saying this is going to be more radial right here. You can see a little branch of it there. Ulnar is going to go back behind, and you can kind of see it right here. See it right there? Okay. And then common carotids, we talked about those. Lingual arteries, we're not going to go up into the neck or up into the base of the throat region, the pharyngeal region. So you're not going to have to worry about those. So don't worry about lingual artery. External carotid, yes. Actually, no, don't worry about external carotid. We're just going to go to commons. So common on the right is usually tied off. because this is where they do the injection for the arterial side. That red color is a latex dye that they stick in it. It provides the color, of course, and it makes those vessels a little bit more elastic, better or more able for us as we're doing dissection to resist the tugging and tearing that we typically exert on those vessels. Vertebral arteries, sometimes we see them, sometimes we don't. They're going to come off like right about in here, and I won't test those, but they usually come off and they go directly back into the cervical region. Now, vertebral arteries are going to go into that transverse cervical frame, and remember, if you look at the cross section through a cervical vertebra, it's got the central canal where the cord sets, but they got these two little holes on the side, and all 7 cervical vertebrae have those. Those little holes on the side are called the transverse cervical foramen, and they are where the holes through which the vertebral arteries pass. Okay, so that's a specific characteristic of cervical vertebra that we don't see with the other vertebra, transverse cervical foramen, because the vertebral artery travels up in there, and I'm not seeing. It looks like it was here, probably cut. But and that's very common for that to happen. Sometimes we see beautiful ones, but I'm not seeing a great one here. That's probably it. That's not bad, but that's going to be probably it right there. Also, too, we want to be careful. See this little thread, this little piece of floss? This is going to be the phrenic nerve that's going to go down on both sides to the diaphragm. We don't want to destroy those. We want to keep them intact because they are actually what control the diaphragm and its ability to contract. We're not going to worry about costocervical trunk. You can scratch that off. Sometimes we can find thyrocervical. So thyrocervical is, now this is actually external jugular coming up. Thyrocervical is usually going to send a branch, this is more the vein side, send a branch over to the transverse, this would be like suprascapular and transverse cervical over here. And then there's usually a branch that comes off that goes up to the thyroid gland. That's why we call it the thyrocervical, because it comes up from the bottom, and this would actually probably be branches of the venous supply on that side. But I'm not going to ask you thyrocervical on or costocervical on the cat. We might do it on the cat, but we might do some of them maybe from those drawings or drawing like that. But I promise you we won't ask them on the cat. Next thing, internal mammary. Same thing as internal thoracic in humans. This is a great shot of them. You can see, and not so well on this side, but they're there. The artery and vein going along the inside of the thoracic cage there, but it's much more evident on this side. These would be your internal thoracic artery and vein, or internal mammary artery and vein, both sides. Axillary arteries, we talked about that before. We've got the subclavian here within the thoracic cavity. Okay, once we get past the ribs, first rib, now we call this axillary artery in the armpit, and when we get to the arm, then we call it the brachial artery. So, subscapular. Sometimes we'll find a good subscapular. The other cat I was looking at on Tuesday had a really good one, went back into that region, that subscapular region, and I'm seeing, looks like it's been torn here. That was it right there. See if we see it on the other side. All right, so there, this is where it usually goes. Well, here we go. So this is going to be subscapular artery, kind of this vessel right here, that artery right there. We might ask that on a picture, but not on the cat. I try to be relatively fair when it comes to the cat. The vessels are relatively large and easily identifiable, then I would say that they're fair game on this, but some of these aren't, because you don't, unless you do a lot of this, it's hard to find out or find where they're actually traveling. But that's probably a pretty good note right there, going back in that space right there underneath. This is latissimus dorsi. Underneath latissimus dorsi, back in that region, is subscapular. And those usually be an artery and vein for that. Brachial arteries, we talked about that. Artery in the arm, okay? Brachial artery here and vein, brachial artery and vein right there. Axillary artery and vein right there. Radial artery, we talked about those, and the ulnar arteries as well. All right, now we want to go to the descending aorta. We've talked about that. Here's your aorta right here, right? And then we go down through the diaphragm, down into the abdominal aorta. And the reason why I picked this one is they did a pretty darn good job of separating out the celiac trunk. Now, what we want to see is coming out the celiac trunk are actually 3 vessels this is celiac trunk right here. The first main vessel going over to the spleen is going to be this dude right here. That's splenic. So this is the spleen. Go into the spleen. That's the splenic artery. Makes sense, doesn't it? Another one that we have that kind of goes back here. This one should go off to the liver, but I'm not seeing. We'd have to do a little bit better dissection here. There's also another one that goes off to the lesser curvature of the stomach, and I don't know that we're dissected well enough in that instance. But this is definitely going to the spleen. So that's going to be your splenic. This one's going to go up to the liver if we followed it, and that would be your hepatic. Not seeing anything else underneath there. But you want to see a little bit better dissection than what I would say there. That's going to be your left gastric. Way back in there, I can kind of see it. I don't know if I can bring it up. You see there's a little bit of a red vessel right there. Do you kind of see? Some of you can kind of see it. See if I can bring that up. Right there, see it? No, that could be it, but it could also be a tributary of the left gastric. So the next one is going to be your superior mesenteric. In the cadaver anatomy, I always talk about the fact when you look at some of these diagrams, they show the celiac trunk and the superior mesenteric coming off like this far apart from each other, and they simply don't do that. The analogy I use is they come off like a sideways V from your fingers. This would be celiac trunk, this is superior mesenteric. That almost looks like they come off together. And this is pretty representative of what would look like in a human as well. Celiac trunk, superior mesenteric going down into the intestines. Okay? And then, since we're on this talk about mesenterics, this is going to be then the inferior mesenteric going down the lower portion of the colon, large intestine. So, celiac trunk, superior mesenteric, inferior mesenteric. Okay? Next thing, left gastric, hepatic, splenic, superior. All right, adrenal lumbar. I noticed that you had it here, but it's been cut. So coming off the abdominal aorta, actually no, forgive me, that's I always do that, iliolumbar. And your adrenal lumbar is gone as well. So remember the adrenal gland set up here on the, we just did the one on the left side. So there's the kidney. The adrenal gland sets right here. And there was a little blue vessel that went across it when we were doing the endocrine dissection of the cat. Remember that? Little blue vessel that went across the top of the adrenal gland. That's the adrenal lumbar vein. You don't really see the artery. It's there, but that's the adrenal lumbar vein. And then contrast that with the iliolumbar artery and vein, which are these two right here that we're connecting to the aorta. They've just been torn at that location. So there's your iliolumbar on the left side. Adrenal lumbar would have come across here. These are probably branches of it right here, going upward. And we now have, let's see, renal arteries. Yes, renal artery and vein are right here. Okay, and I want to do this now. This one's also been torn on this side. We might have to run to another cat to show you the gonadals. This is you have a female cat, so the ovaries are going to be right here. That's ovary, okay? The gonadal artery is coming off the aorta and going over to the ovary, and then the same thing happens on the other side. The other ovary, where is it? Right here? No, that's not it. That's the ureter. So the other ovary is going to be setting up here, and the other the other gonadal artery going to the ovary is going to be that one right there. They both come off the aorta, and they come down to the ovary, or they go down towards the testes, all right? And then the right gonadal vein drains from the gonad, the ovary in this case, up to the inferior vena cava, but it's been torn as well, and it would set right, I think that's the end of it right there. That's going to come up. But I'll just tell you right now, we'll run to another picture. I'll tell you right now that the left gonadal vein, it typically arises or drains into the left renal vein. So what am I saying? That the three vessels basically travel like you would think that they would. That's the two gonadal arteries, whether it's testes or ovaries, they come off the aorta and go over to the respective gonad, this direction and this direction. The right gonadal vein goes from the ovary and up to the inferior vena cava. The left gonadal vein, though, that's the exception. It comes from the ovary or the testes and goes up to the left renal vein where it actually enters. Okay, and Justine, go to a couple pages where you see the veins. So so if you look right here, you can see here is the right gonadal vein right there. The left gonadal vein comes from the gonad and goes up to the left renal vein. So go back another page for me. If you look for the gonadals, do they even have them here? I don't really see a good shot of the gonadals. So, but that's the way they, let's see, gonadal vein. So here's gonadal vein here, and or gonadal artery here, gonadal artery right there.
They're on this page too.
Yeah, so you can see a little thin one there, and then you can, so we know we have a male in this case. You can see the gonadal artery going down through the inguinal ligament, and you can see it kind of coming down through the inguinal ligament on that side. Okay, so thank you. We talked about adrenal lumbar, we talked about testicular and ovarian, and we talked about inferior mesenteric, talked about iliolumbar. Now we're going to go down. The reason I picked this cat is because it's got some really good pelvic vessels. So if we come down here, the aorta on a cat is different than a human. The veins down here are like the human, but the aorta is a little bit different. Now what I want you to notice is that coming off the aorta, this branch right here is external iliac. This branch right here is internal iliac. And that they've torn this here, but there's this median sacral that comes down and goes down into the tail, and that would go back into that little open space down in there. So that would be your median sacral that goes to the tail. So we've got really good left external iliac, really good left internal iliac, really good right external iliac, really good right internal iliac. And then on the venous side, I don't know if we can see a good shot. I don't know if it's completely dissected, but what we'll actually notice is that for the inferior vena cava, it comes down and then it branches into two what we call common iliacs, and iliac veins. And then coming off the common iliac is then a vein, and I can see it right down in there. I don't know if you can see it with your, if I can get this opened up a little bit. This is a really good shot. If I can open this up so get a little bit less, or a little bit more light in there, but what I want you to see is this vessel right here. This is the common iliac vein, and then this is the external iliac vein, and then that vein down in there is the internal iliac vein, okay? Going off to the side there. So that's internal iliac vein, external iliac vein. You with me? Now the deal with the external iliac is it travels through the abdominal wall. So the abdominal wall would come across like this. So here is your external iliac within the abdominal cavity. Once it travels through the abdominal wall, actually this is actually sartorius, but once it travels through the abdominal wall, then that external iliac becomes the femoral. So now we're dealing with femoral artery and vein in this location, okay? And then coming off of the femoral artery and vein is going to be this vein and artery. So the vein right here, and you can see a little bit of it, a little bit more dye down below, but the artery is called the saphenous artery. There's a nerve in there as well called the saphenous nerve, but the vein is called the great saphenous vein. Okay, so that's going to go along the medial aspect of that, the junction of the knee. So this one's going to be, and the same thing on this side. Sometimes we don't see the dye as much on that right side. It doesn't get in there for whatever reason, just doesn't pick the dye up. It's too wimpy. So we see here is your right great saphenous vein and the saphenous arteries in there. Okay. Now we come over here where the femoral goes behind the knee now. In a human, what I always tell people is when that femoral artery and vein travel through this little hole in the adductor magnus called the adductor hiatus. Once it goes through that adductor hiatus, it then travels in behind the knee, which is the popliteal fossa, and that's where we would call these vessels the popliteal artery and vein. So, and what I want to do here, I don't know if we can see this, and I haven't dissected, so I'm not sure if we can actually see it, but between the two heads of the gastroc is where the posterior tibial artery will travel, and I don't know if we'll be able to see it. I don't want to spend too much time here, but you can kind of see it right in there. Posterior tibial artery, what's left of it's right there. And then the anterior tibial artery is going to be there it is. Anterior tibial artery is behind the tibialis anterior, and that's the artery right there. So those are two main branches. We also have a peroneal that's going to be out in here as well, but it's hard to see on the cat. Okay, external iliac, popliteals, sural artery. Sural artery is going to be a very superficial artery along the back of the calf, along the back of the gastrocs. And sometimes we don't see it. Here it is. Okay, so there's sural artery coming down the back of the gastrocs here. And that's it for arteries. So superior vena cava, we covered that, but let's go over it again. Actually, no, we didn't. Superior vena cava is coming off here, okay, coming up. And it's going to branch into a left and right brachiocephalic trunk. Cats and humans have a right brachiocephalic artery or trunk, okay? And cats and humans also have then on the venous side, they have a left and right brachiocephalic vein. So this is the left brachiocephalic vein. This is the right brachiocephalic vein coming off of the precava or the superior vena cava. Okay? Actually, no, this isn't forgive me, this is not. This is internal iliac. This is the brachiocephalic up here and brachiocephalic right there. Okay? So still superior vena cava right there, or precava. All right, now what do we have? Pulmonary veins, you can scratch those out. We said you could get rid of those, but they're in here. You guys did a pretty good job of dissecting those out. Remember, the arteries and veins are confusing when we talk about the ones up with the lungs, because the pulmonary artery is sending unoxygenated blood to the lungs from the heart. Arteries are always the same. Arteries always leave the heart. Veins always come back to the heart. But the pulmonary artery is sending unoxygenated blood to the lungs. The pulmonary vein is returning oxygenated blood back to that left atrium. All right, now we want to talk about azygous. Did you guys do azygous vein? No. Oh, yeah, you did. Good. All right. Where's that scissors again? We're going to cut the diaphragm so we can pull some of these muscles away and we can lift this up so you can see. So azygous vein is that dude right there. By the way, this is just dried blood. This is all dried blood here, but this is azygous vein coming along the right side. So the aorta comes down like this on the left side. Azygous comes down the right side. These are still, the red ones, those are still intercostal arteries coming over to the right side of the chest wall. Internal mammary, we already talked about those veins. They're going to run with the internal mammary artery, right? Vertebral veins, we're not going to worry about those. Brachiocephalic veins, we said before, this is brachiocephalic vein on the right side, brachiocephalic vein on the left side, right there, okay? External jugulars, okay, this is external jugular going up, and this is external jugular going up on this side. Easy to see. Subclavian veins, now, so here's what we say. Subclavian veins are relatively short in a cat because we have the brachiocephalic trunk right here. Brachiocephalic trunk, and as soon as we have the branching, here's your external jugular, that vein right there is going to be your subclavian vein, but it's very short because as soon as it goes through the chest wall, now it becomes axillary vein, right? Once we go from the armpit, now it becomes a brachial vein. Then we got radial and ulnar veins as well. Subscapular veins, you can get rid of those. Brachial veins, we just covered those. I want you to know those. Cephalic vein is also kind of a cool one. Cephalic vein is this dude right here, easy to find. So it's going to be on the outside of the shoulder, and down the outside, kind of the outside of the arm. If you look at bodybuilders or people in really good shape with very low body fat, you can see that tortuous vein when they flex on the outside. That's cephalic vein. Hepatic veins, all right. So hepatic veins, we will not test you on those here. I want you to know them on, and we'll learn those when we cover the human, obviously. But hepatic veins are going to be coming out of the liver going into the inferior vena cava. Do we have an inferior vena cava here that we can see? There it is right there. So inferior vena cava is this structure right here. Let's see if I can find it. There it is. The diaphragm keeps getting in the way, but that's inferior vena cava. There are veins that go from the liver into the inferior vena cava. They're called the hepatic veins. Don't confuse that with the hepatic portal vein that we'll talk about in lecture. I'm not going to do the triple injected. I don't do that in here. But the hepatic portal vein is going to come up in this region. But we'll cover that in lecture. I just want you to understand the concept. But I will not test you on hepatic portal veins or hepatic veins on the cat or over there as well. Adrenal lumbars, okay? So adrenal lumbar veins, of course, are going to run with the adrenal lumbar arteries. The adrenal gland's been obliterated here, so it's not evident. Iliolumbar, of course, that's going to run with the iliolumbar veins, or artery down here. That's iliolumbars coming off inferior vena cava and the abdominal aorta. Renal vein, renal artery. Testicular and ovarian veins, we already talked about that, right? Testicular, left testicular vein, ovarian vein goes into the left renal, okay? Left renal. And then we talked about the iliacs down here too, how they were different, didn't we? Popliteals, hepatic portal vein, you can scratch that out. Superior and inferior mesenteric veins, you can scratch those out. They're part of the hepatic portal system, so we're not going to cover those. So we've gone over everything. Let's run over to one more cat over there. Can I take this probe? Whose scissors was these?